right. Hey, everybody. It's Misty Williams here from Healing Rosie. And this is the long-awaited follow-up interview with Dr. Michael Ruscio. You guys hear me talk about him lots. We reference his book, Healthy Gut, Healthy You, very often when conversations here in the group in particular, and when I get emails from our community, kind of start spiraling into the gut health space. There's so many questions that we all have about healing our gut. We hear from many, many practitioners in our space how important it is. If you want to reverse disease, fundamentally, you've got to go into the gut and heal what's going on in the gut. So we know it's important. Many of you have attempted gut healing on your own. You've worked with practitioners who've tried to support you with gut healing. Sometimes you get results, sometimes you spin your wheels. So what I've been doing is compiling a list of questions from our community. We also did a Heal Your Hormones boot camp right after the Fix Your Female Hormones event last fall. And many of the women in that group also purchased Healthy Gut, Healthy You. We did kind of a book club study on the book toward the end, and many of those women had questions too. So we're going to try to keep this around half an hour today. But Dr. Ruscio, I'm so happy that you're here.
Hi, happy to be here. And thanks for recommending the book.
Of course. I loved it. And I actually felt like as we were getting to the end and all of us were talking about things that you were teaching in the book, I felt like there was probably this whole dimension of what you offer from a supplement perspective and really helping that that I should dive into more, because it's one thing to know, from a prescriptive perspective, here's kind of a process you go through, but finding the resources that we need too in order to actually be able to implement these protocols can be really challenging. So toward the end here, I'm going to ask you to tell us a little bit more about how you have things set up on your site so that women can get resources there as well. So awesome. Yeah. So we've had several conversations recently in the Facebook group, and this is where I'd kind of like to start, where people have asked questions and have wondered about things that I feel like we haven't really gotten clarity for. Right. So the first one is parasites. So we hear a lot in our community, especially when you get into Lyme disease and things like that, how important it is to do parasite cleanses. One of the things that comes up for me when I think about the things that we're doing to our gut is that we seem to have a problem with biodiversity anyway. Mm-hmm. And I've heard it expressed by some practitioners that maybe we shouldn't be so aggressive in going after all these parasites when we don't really know what's in our own microbiome. I don't know if we should carte blanche be doing parasite cleanses. And I'd really like to get your perspective on that, because I think it's an easy thing for someone to hear someone talk about parasites and they can keep you up at night. Well, I'm up at night. Maybe I should do a parasite cleanse, and it's hard to figure out if you have parasites from the lab tests because of X, Y, and Z reasons. So maybe you could clear the air, the smog on this parasite issue.
Mm-hmm. So with parasites, we first have to be careful in the language that we're using, because sometimes parasites are used kind of as a catch-all. And just to clarify, you have dysbiosis, which is loosely defined as imbalances in stuff that's kind of supposed to be there. So some of the bacteria or fungus that should be there, now they've overgrown and there's dysbiosis, or perhaps there's not enough good bacteria, dysbiosis. Mm-hmm. Parasites are more so, that means an infectious agent that shouldn't be there to begin with, like an amoeba, like a pathogenic amoeba as an example. And it's important to kind of clarify those two, just so we're using accurate language. Now, regarding should we do periodic parasite cleanses, maybe. Now, really, when we use treatments for parasites, many of those treatments also act against dysbiosis. So if you're doing a parasite cleanse, many of the herbs that you're using could also treat small intestinal bacterial overgrowth if present, or could treat yeast or fungus if present. So I think the question really is, should you be administering any kind of antimicrobial agents? And I would get past, what is the one thing or couple of things that you're using it for? Because as you alluded to, it's hard to definitively pin that down, even with testing. And that's one of the premises I try to develop in the book. As tempting as it is to think we can identify that one thing in the gut that's causing all your problems, and while there are some cases like that, it's more about restoring a healthy gut ecology or a healthy gut ecosystem. Mm-hmm. So where does choosing something like a parasite cleanse or antimicrobial herbs fit into the objective of really holistically improving the gut ecology. It does fit in there, but it's not one of the first things that you should do. It's one of the later things that you should do. And I codify this into the stepwise process in Healthy Gut, Healthy You. So it can be done, but it wouldn't be the first thing that you do. Now, why not? Well, if you have all these inputs to the gut that are unhealthy, then what you're doing is you're creating a soil or a milieu that encourages unhealthy bacteria to grow. So even if you come in there with antimicrobials and try to get rid of the bad stuff, if the ecosystem is such that it's encouraging bad stuff to grow, you're like scooping water out of the sinking ship.
Right.
So we have to lay this foundation with improving gut ecology. Now, I know that sounds kind of trite and platitudinous, but there are some specifics there that people can work towards. Diet and lifestyle basics, meaning don't eat processed food, that whole spiel, getting enough sleep, exercising, getting sunlight, community. I think everyone is probably clear on those. The second step is maybe a little bit more less clear cut, meaning should you go on a paleo diet or go on a low FODMAP diet? And that's where some of the nuance and confusion regarding gut health comes in, because either one of those can help a certain person or harm a certain person. So there is some nuance there. But the point I'm making here is you want to start with this foundation, build you up to get progressively healthier with some of these more foundational interventions, diet, lifestyle. I would also add to that probiotics. And then if someone is still symptomatic, then considering a course of antimicrobials administered on top of that healthy foundation that you've established has the highest probability of success. So I hope that kind of answers the question.
Yeah, that's really great. So one of the things I really loved about the book is basically how you outlined your Gradient 8 plan, where you take people progressively through, fix this first and then look at this, fix this next and look at this, which the women in the group that we were doing the Heal Your Hormones boot camp found really helpful. My cousin actually went through this program, and it's been your program, the in Healthy Gut, Healthy You, and she has had amazing changes in her entire family. She got her husband to do it with her. She has a son that has autism. They've been working on it together. She said that whenever she started your program, she was keto. And that's how she lost a lot of weight, was doing the keto diet. She was like, I was sure that when I bumped my carbs up to, 100 grams a day or whatever, that I was going to gain weight. She was like, but surprisingly, I didn't, because the way that you had it laid out in the book for her and the way that she followed it ended up being really, really good for her. And I think just fed her gut in the right way. So I just respect the work that you've done putting all of this together. I can't imagine how painstaking it was to actually create the book so that from the perspective of the reader, it's really easy to follow. So that's super fantastic.
Thank you. Yeah, it was a long time in writing.
Yeah, it's evident. So, okay, we had another woman in our community talk about experiencing a lot of fungus in her feet. So she's experiencing a thickening of the toenails and just the typical thing that you see with the fungal infection, and topicals haven't worked. So there's speculation now that perhaps there's a connection inside the gut. So could you help us understand the connection between these skin manifestations, or, what she's experiencing on her feet, and what's going on in the gut?
Great question. There is this old saying in naturopathic medicine that the skin is a reflection of the gut. And that does seem to be true to a degree. Does it hold true for every single issue of the skin or of the nails? I'm not sure. I think we're lacking data in some of these regards. For example, I haven't seen a study that has tried to correlate to toenail fungus, intestinal fungus, and then went another step to say, how does the toenail fungus look after we've treated the intestinal fungus? I can speak to this clinically, where some cases do seem to improve, but I can't say it's every case. So I would say definitely go through a process to optimize your gut health, because there's literally no downside to that. And a potential upside could be clearing or improving skin and nail issues, but I can't say it's 100% correlated. Right.
Okay. That's great. Alrighty. Another woman in our community worked for a year with a functional medicine practitioner that's very popular in our space, working on gut health. She had an H. pylori infection and seemed to take a long time to eradicate. Felt like she was making a lot of progress with gut health, and within 6 to 8 months of clearing this H. pylori infection, it was back. So my question is for people, and I've actually heard this a few times in our community, that someone goes after SIBO, handles it, and then it comes back, you know? So it seems like some of these infections can be recurring. Can you help us understand why these infections continue to be recurring? Are some people just more predisposed to it? And what do we need to do to kind of get over the hump so these aren't constantly coming back?
Right, right. So again, here there is a clear delineation that should be established between if someone has a recurrence of an infection or if they're having a recurrence of their symptoms. Because oftentimes there's a conflation of the two.
Mm-hmm.
And what people will do is they'll create this boogeyman where every time they're not feeling well, oh, it's my SIBO.
Yeah.
And that's a very unhealthy and unscientific and non-productive way of looking at this. I would highly encourage people not to do that and to realize that your symptoms returning usually occurs due to multifactorial causes. And it's not a good exercise to blame just this one thing. And with functional medicine lab testing, we also have to be very cautious because some of these tests do suffer from what's known as a false positive, meaning you will see a positive on your lab test, yet there is no actual infection or dysbiotic organism present. And what that will do is it will create this neurosis where people are always thinking, oh my God, I still have H. pylori, it's back, I still have it, it's back. And I can't tell you the number of times and case studies that I've written up in our clinicians newsletter where we will run in parallel a functional medicine test that will show H. pylori, and then we will also test that against your more gold standard breath test and stool antigen recognition, and both of those come back negative. So it's important to understand that at the cusp of progressivism, there are some things that have been fully flushed out and other things that are more kind of experimental and we're still figuring out. So you have to interpret your labs with a large grain of salt. Mm-hmm. So to the point of, well, what do you do about your symptoms when they return? That can happen. And that's not abnormal for someone to have a regression of their symptoms. Now that could be linked to a regression of dysbiosis or an infection, but that's not always the case. And it also doesn't fully seem to matter exactly what caused the regression. What's more important, in my opinion, is to understand what got you to the point where you feel healthy. If you can figure out what inputs got your gut to the position of being non-symptomatic, then revisiting some of those points can help you get back to that non-symptomatic presentation. So, and this is something I also talk about in the book. If you were on, let's say, a low FODMAP diet, and that was going really well for you, and then you reintroduced, and that reintroduction went pretty well, and you're eating a broader diet, but over the months, perhaps you were eating more FODMAP than your gut could tolerate, the solution there may simply be bridling back your FODMAP intake a bit, just like someone who, let's say they were trying to lose weight, they brought their carb intake down a little bit, they lost weight, and they're happy about it, and then they start relaxing a little bit, they're eating more, eating unhealthier food, and they start gaining weight. It's easy for people to identify, okay, I've been a little bit lax with my carb intake, I need to tighten that up a little bit and get my weight back down, just as one example. The same thing happens with your gut. It doesn't mean that there's some nefarious infection there that needs to be eradicated. There can be, but I would think of it more simply in terms of, okay, so let's say in this case, she needed to undergo antimicrobial therapy in order to get to a point where she was feeling well for the H. pylori. She may need to revisit a touch-up of that to get her back to that point where she is no longer having symptoms. Or better yet still, if she wasn't using a probiotic, I would put a probiotic first in terms of the order of operations before trying antimicrobials, because probiotics can actually achieve some of the same endpoint that antimicrobials can. And I think it's more tenable to recommend probiotics because they have these secondary benefits, like helping to lower blood sugar, cholesterol, being anti-inflammatory, stabilizing the immune system, and improving mood, things like that. So, and this is, again, is where I think Healthy Gut, Healthy You is really helpful for the reader, because it walks you through this order of operations. What should you do first, second, third, fourth? And so what may have happened in this case, presumably, I don't know this, of course, I don't know the details, but they may have leaned a little bit too heavily on the antimicrobials. They didn't establish a healthy foundation. So like the scooping water out of the sinking ship, that helped for a little while, but the hole was never addressed. And so she's seeing this regression. And that does happen to a lot of patients who don't follow the appropriate order of operations in terms of building up a healthy foundation. They'll find a therapy that's more at the apex of the pyramid that relieves their symptoms for a short term, but they keep needing to return to that because they haven't laid the appropriate foundation underneath.
Right. Okay. I want to ask you about probiotics, because this is obviously something that we hear about a lot in our space, taking probiotics. I just watched a video that Robin Openshaw created, Green Smoothie Girl, about where she basically did a test of a bunch of probiotics. And she basically took a dish of milk, put the probiotic in it. If it kind of created that culture ring on top, it was alive and active. And if it did nothing, the probiotics were basically dead and weren't doing anything for the body. So what comes up for me as someone who, if we take off the thought leader hat and just put the consumer, I'm just like everyone else in our community, is how do you know which probiotics are really good? Does refrigeration matter? Are you a fan of like the spore probiotics? Like, talk to us about just sourcing when it comes to probiotics.
Sure. So to get kind of my quick probiotic protocol, we did create a page that kind of puts this all in one summary. And if people go to Dr. Ruscio, druscio.com/probiotic, it's either probiotic or probiotics. But if you search either one of those or type that in, you'll get kind of a one-page PDF summary for this. But Perfect. Essentially, yes, quality matters, and you want to make sure that you're getting your probiotics from a company that is reputable and follows things like good manufacturing practices, GMP. One of the ways you can help to ascertain the quality of the probiotic is the price. So if you're seeing of a given ilk of probiotic, they're averaging around $60, and then there's one for $20. If there's this huge difference in the price, then you should be careful about that. Mm-hmm. Now, it does hold in the other direction also, where if a probiotic looks exorbitantly more expensive, then they may be essentially ripping you off. So there is just looking at the price as a way to kind of generally identify quality, and then looking for reputable companies. And there's a number of them out there. If you're not sure, I would look to someone like myself who's kind of done that homework for you, because I wouldn't expect a layperson to know to look at good manufacturing practices, or that a third-party independent tester is periodically assessing batches to make sure that the label claim meets what's actually in the probiotic itself. So that is one thing that's fairly easy to surmount if you just follow a reputable source. And I'm sure by looking at people in this community or other thought leaders, you can be directed towards some good sources of probiotics. So that shouldn't be too difficult. I wouldn't recommend just going into the nether realms of the internet and deal shopping for the cheapest probiotic that you can find, because that's when it's going to be much more of a dangerous territory. Now, there's another very important concept regarding probiotics, and I can't overemphasize how important this is. We just this week published a case study on our website of a gal who had been trying all sorts of probiotics, and she thought, and not responding to those. And she thought she was going to need elemental diets and antimicrobials and prokinetics. She was building up in her mind, well, the diet and the probiotics just don't work for me. So I'm pretty sure I'm gonna need these more advanced treatments that I hear you talk about. But when she came in, it was fairly evident that she kept trying a different formula of the same type of probiotic. And what I mean by that specifically is you can break most probiotics down into one of three categories. And this is very important, because probiotics can be very helpful. For some people, a certain type of probiotic won't sit well with their gut and may cause a negative reaction. And it's very unfortunate when someone keeps trying, like let's take the soil-based probiotic you mentioned earlier as an example. Mm-hmm. They try prescriptive cyst, have a reaction. They try megaspore, have a reaction. They try biospora, have a negative reaction. And then they go, probiotics just don't work for me. Well, you kept trying different iterations of the same category of probiotics, so it makes sense that you keep having the same negative reaction. So this is why I organize probiotics, and I also elaborate this at that URL and in my book into the three categories. Category 3 would be your soil-based or your spore-forming. Mm-hmm. Category 2 is Saccharomyces boulardii. And category 1 is a mixture of different lactobacillus and bifidobacterium strains. And the exact strains don't really seem to matter as long as you have a number of those in there. And in my opinion, and this is fairly evidenced, I think, by the research, what's more important is to have someone find the one or combination of probiotics that sit well with their gut, and also identify any that may irritate their gut, and then continue forward with the ones that seem to be beneficial. And that's how you customize the available probiotic categories to your gut, and you can get off of this merry-go-round of a new study was published, heralding this as the best probiotic, and then 6 months later you see another study being published. And I understand that the supplement companies have to market their products, and that's fine, and they're using the scientific research to do that. That's fine, but it creates a lot of confusion on the part of the consumer, because now there's this never-ending litany of marketing claims about how every new probiotic is better than the last, right. And it misses the larger picture, which is we can take all these studies and they organize into these 3 categories of probiotics. And as long as you have a quality formula that delineates between these 3 categories, now the game is giving them to you and seeing which ones sit well. And for the small number of people who maybe have a negative reaction to a certain category, identifying which one that is and not using that one. And if you do that, like this patient did, I believe her name was Phyllis, she saw improvements in her gut health she had never seen. And sadly, because all we did was get her off of the merry-go-round of trying one category of probiotic, have her try the other 2, and she saw tremendous results, and that pretty much got her over the hump. So
yeah, that's awesome.
Yeah.
Awesome. Okay. It comes up quite a bit in the community too, where people are working with a functional medicine doctor, and they usually I see this with yeast and SIBO mostly, where the condition seems to be severe enough that the doctor wants to prescribe an antibiotic. I would like for you to kind of help us understand contextually, is there ever a time in dealing with gut issues that an antibiotic is the right approach? Is it something that we should always shy away from? Do we get overly reactive when someone says antibiotics for SIBO, for example? Are we being too hardline to say, I will never try an antibiotic? Help us understand kind of that space.
Yes, I agree. I think we are being too hardline if we ever say, I will never try an antibiotic. There certainly is a strong case to be made that indiscriminate use of antibiotics is a very bad thing, especially in infants and children. So we only want to use them when we absolutely need to in infants and children. Another thing that I kind of outline in the book, they're less detrimental in adults, and when used the right way, it can actually be quite beneficial. And it's unfortunate that sometimes probiotics are to blame for the entire situation of the Western microbiota when there are multiple inputs that are not healthy in Western civilization for the gut. And I talk about this also in Healthy Gut, Healthy You. A group of researchers studied a hunter-gatherer tribe in New Guinea, and this hunter-gatherer tribe had access to antibiotics. So when people got sick or they had certain infections, they could go to the local clinic and use antibiotics, but they were still living as hunter-gatherers. And they found that even though they had use of antibiotics as part of their system, they had vastly more diverse and what we think are healthier microbiotas than we do. And that's likely because they're living a healthier lifestyle. They're in contact with dirt and animals and getting more time in the sun, presumably. So antibiotics are not the only factor. They are a factor, and we want to be very cautious, again, in infants and children, and not to use them indiscriminately in adults. Oh, I've got a sniffle. It's been here for 3 days. I'm annoyed. I'm going to get a Z-Pack. That is silly. We should not be doing that. Yeah. But if you have a diagnosed infection, whether it be a fungal overgrowth and you're going to use something like diflucan, or a bacterial overgrowth and use something like rifaximin, I think you can definitely make a case for that. And I do not have much reservation at all using antibiotics as such. They will not, most of the data does not support the contention that antibiotics are going to be like a bomb in your gut and wipe out all of your bacteria. Herbal antimicrobials and pharmaceutical antibiotics, in my opinion, within reason, there's some antibiotic exceptions that are incredibly broad spectrum, but they have a similar impact on the gut. And how I term that is they give the gut ecosystem a nudge. And what can happen is, we're working in this framework of trying to build a healthy gut ecology from the ground up, as we've been discussing in kind of that pyramid model. All those factors try to tip the balance in the favor of the good guys. But even with all those healthy factors present, sometimes the bad guys still have their foot on the neck of the good guys. And this is when using something like an antibiotic can kind of give a knock to these bad bugs and allow the ecosystem to recalibrate and equal out in favor of the good guys. Right. And whether that's an antibiotic or a pharmaceutical antifungal or herbal antimicrobial, if we use them in that context, we really, for the most part, show minimal downside and maximal upside.
Okay, awesome. All right, I got some questions from the community here. First one is from Jill. If an initial round of, I'm not going to say these right, rifampin and neomycin were prescribed for constipation type SIBO and a second test comes back positive, would you jump to the elemental diet, or can a cure be found with higher and higher doses of antibiotics?
Well, I don't know the dose they're using, but assuming they're using the standard dose for rifaximin and neomycin, they may need to retreat. And there are papers showing that some patients will need multiple rounds of treatment with rifaximin and neomycin, especially if their gas levels are highly elevated. So if you have someone with, let's say their hydrogens at one point at 100, or even their methane is near 100, if you have a fairly high elevation, it may take multiple rounds to knock that down all the way to normal. So part of this just makes sense, where if you have a lot of gas and you need to go down to 20 parts per million, let's say for hydrogen, it may take you multiple treatments to get there. So the dose may not need to be higher per se, but the duration of treatment may need to be longer.
Okay.
Now there's various arguments that people will hear on the internet. Biofilm agents, maybe they'll help. Feeding the bugs with prebiotics, maybe that will help. Using things like red rice yeast or other statins, that may help. None of those things I think are cathartically beneficial on top of just the standard retreatment again with the antibiotics or with the herbal antimicrobials. So if you responded well symptomatically, I would undergo another round of treatment. If you didn't respond well symptomatically, then I would consider another course of treatment. I put the patient's symptomatic response over the objective lab values. So if you felt like, yeah, I felt better from that round, and my SIBO labs are still positive, then you may just want to treat again with that same therapy. If you felt not that great, then you could try the elemental diet. And there's one other thing here that's very important to include in this dialogue, which is if you're non or asymptomatic, if your symptoms are pretty much gone and your labs are still positive, I look to the symptoms first, because there is not a 100% correlation between SIBO lab findings and the way someone feels. There are cases that will have no symptoms that still have a breath test positive. And we've published a number of those on our website. So make sure that you're not just treating the labs at the expense of your symptoms. If your symptoms are acceptable, then you may not require any further treatment with the antibiotics.
Right, that's really good. Okay, she also asked, what do you think of Antrantil for SIBO?
Yeah, I think it's one of many options. We did a small short study in my office on Atrantil compared to herbal antimicrobials, and I don't think we've got enough data collected yet to really be able to comment from a statistical perspective. But the sense that I get is it's about as effective as some of the other antimicrobials. Other antimicrobials might be a little bit more effective in my observation. So I'm open to it. I think it has a novel mechanism that it purports to operate by, which I think makes people want to try it. And I wouldn't discourage anyone from trying it, but I would also caution people not to think that something new automatically means that it's better.
Right.
In my experience, some of the more core antimicrobial protocols seem to work as well, maybe a little bit better, but certainly it's something to try and to consider.
Right. Okay. Teresa says, how do you heal your stomach when you have autoimmune gastritis and low stomach acid? I've had numerous gut infections over the last 10 years, including recurring H. pylori, parasites, and SIBO. I think I have a handle on the infections, as I have been doing antimicrobials steadily for 5 months now, but want the lining of my stomach to heal to prevent further infections.
Gotcha. So I'm assuming she's talking about atrophic gastritis or as you said, autoimmune gastritis, which oftentimes has an antibody you can use to track that, which is your anti-parietal cell antibodies. These are antibodies to essentially a cell in the lining of your stomach. There's mixed data in terms of will treatment of H. pylori improve that process. There have been 2 studies done in Japan showing that injectable vitamin B12 can actually arrest that stomach autoimmunity. So that is something to consider. And if you search my name and something along the lines of revolutionary treatment for maintaining your HCl, you should be able to find one of the video reviews I did of these studies. This is something that is seen so infrequently, at least in my practice, that as interesting as it is, I can't say it's something I've really been applying to be able to say, it's had much of a clinical impact on patients one way or the other. But there have been 2 studies published by this one group in Japan showing that injections with vitamin B12 were able to arrest the anti-parietal cell antibodies, which is the antibody marker for looking at the progression of gastritis, which can eventually become atrophic gastritis, meaning a fair degree of atrophy.
Right.
Something else to consider are some of the kind of classical gut healing nutrients, like zinc as one, aloe, glutamine. So there's a number of cocktails out there. I use one called Gut Rebuild Nutrients. You may want to consider that in a fairly high dose and see if that is helpful. And so those are a few things that may be helpful. One other thing that I should mention, I've heard more so through the grapevine, and we have had Dr. William Seeds on the podcast to discuss this, is a peptide known as BPC-157. And it's essentially a peptide that can help with healing of gastritis and lead to other tissue healing. And if you search my name, Michael Ruscio, along with William Seeds, or just Michael Ruscio and peptides, you should be able to find the interview with Dr. Seeds, and he talks about this compound also. And that would be one of the last things I would try, because it's least cause focused, but also something to consider to help with the gastritis.
Right. Okay. Fantastic.
I'm sorry. One other thing, potentially consider a low histamine diet, because sometimes people with gastritis, they can have this easily agitated immune system. And if your immune system gets revved up, part of that mediation is by histamine. Histamine stimulates gastric acid secretion, and too high of a release of acid can start to erode the lining of the stomach, and a low histamine diet can be helpful for that.
Perfect. Okay. Lynette says, in an interview that you did with Dr. Ruscio about healthy gut, he mentioned a detox of diatomaceous earth, ginger, lemon, and 1 quart of water. Do you know how often he recommends doing this? Is it once a day? For how many days? And how often should it be repeated?
So that specific protocol I haven't recommended. I recommend people to do what I call a modified fast, where they either use the Master's Cleanse solution, which is essentially maple syrup, lemonade, and a pinch of cayenne pepper diluted with water, or bone broth. And they do that for anywhere from 2 to 4 days as a liquid diet reset. And that is something that you can use periodically. There's no set rule for how to do it. Some people will fast a couple days a week, just during the morning hours, and then eat a normal lunch and dinner. Other people may do a 1-day fast once a week or once every other week or so. So there's no set rule. The more important thing is just to listen to your body. And if you feel good from a degree of fasting, continue with it. But be cognizant that fasting is a healthy or a hormetic stressor, but a stressor nonetheless, just like exercise. So a degree of exercise is healthy for you, but if it's more than your body can adapt to and recover from, then it can become detrimental. So be careful about that, because some people feel better when they fast. They start fasting too much, and then they start not sleeping well, being tired, and having brain fog. So don't overuse fasting. Make sure to keep your feelers out and strike that balance.
Okay, great. All right, question from Lauren. What treatment protocol have you seen the most success at for killing yeast? How long does it take? And are fruits and anything like brown rice to be avoided completely during that time?
Great question. I I really don't recommend people avoid certain foods depending on a given infection that they're treating. So if it's SIBO, if it's fungus, if it's H. pylori, there's different theories that you should avoid or emphasize certain foods during those treatments. And that is one of a many canard in functional medicine that doesn't seem to be very significant or very meaningful. And all it does is make people more stressed out and makes their lives harder. So I would simply eat whatever you feel best on is what I would eat while you are treating any infection. Why? Because remember, if we're trying to build up the healthiest gut ecology so that you have the best chance that the antimicrobial agents will maintain a positive balance, you want to eat whatever diet seems to work well for your ecosystem, not for the one infection that we've been able to test. All the while, there's probably 5 things that we've missed because we're really in the nascency of our ability to test. So there's so much wisdom in learning to listen to your body. So in terms of the best protocol, I don't think the protocol is that important. I think you can make a case for many a different cocktail protocol of herbal antimicrobials. The one that I use is the Biotic Clear series with Biotic Clear 1A and 1B for 1 month, paired with Biotic Clear 2A and 2B for the 2nd month. But there's other protocols out there that I think would work in a similar fashion. But what's more important is how you execute that in the larger overall context that we've been discussing. First, finding a diet that works well for you, along with the lifestyle factors, and then considering probiotics, which can be antifungal. And then now you have this kind of very healthy foundation holding you in place. And that's the most opportune time to use the course of antimicrobials.
Yeah. Okay. I just want to mention something as you're talking about this, because what I have experienced as someone who has learned to advocate for myself is the more educated I am in working with my doctor, the more camaraderie we have in our relationship, the better our conversations go. The more I'm bringing like useful questions to the table. And I just kind of want to encourage everyone, if you have gut issues going on and you're working with the doctor, rather than thinking, he made this one recommendation, I need to find out if he or she is right. I would really encourage you to get Healthy Gut, Healthy You and go through it for yourself, because I think what you'll find is when you start to see how Dr. Ruscio has recommended that we kind of stack these different treatment windows, he wants us to lay a really good foundation and then go after certain things. I think you'll just, in general, first of all, be able to do the things that only you as a patient can do. Like your doctor isn't with you at home when you're eating and making a lot of decisions around your lifestyle, right? So if you know the lifestyle things that are really important and you can do those things, and then when you come up to a time where you're treating SIBO or something similar, you've laid a good foundation, you're familiar with what Dr. Ruscio has recommended whenever it comes to SIBO, and you can have a really good conversation with your doctor. I think a lot of times what we tend to want to do is like, someone figured this out for me, and then we take whatever that doctor says and we go and ask, 3 or 4 or 5 other people, do you think my doctor is right? And I just know that you're going to spin your wheels forever trying to do it that way.
Definitely going to spin your wheels doing it that way.
Yeah,
absolutely.
Yeah, you really need to just, buckle down a bit, get the book. If you are overwhelmed by the size of the book, go to the back, look at his Great and 8 plan. It's really, the plan is easy to follow. It's simple. It's not overly complicated. And then when you hit something like you get to phase 3 and there's some things coming up, then you can go actually read those sections of the book where he has actually gone and brought you all of the research that's available on the topic. And he's done an excellent job of that. So I'll ask you another question here and we've got to wrap it up, but I just want to kind of offer that to everyone,
And thank you. And I should also mention that for anyone who hasn't read the book yet and maybe is looking for kind of a cheat sheet starter guide, we did make a quick start guide. And if people go to the URL drruscio.com/gut quiz, what I've made there is first a quiz that will assess if you have one of 3 patterns present that I find to be very common, either solely a gut problem, a gut thyroid problem, or a gut female hormone imbalance problem.
That's awesome.
And based upon how you answer these questions, you will get pointed to one of these 3 variants, and it'll be a varied version of a quick start guide, meaning here's the 1 or 2 dietary tweaks to make, here's a couple supplements to try, and it gives you that simple quick start guide as an easy on-ramp with the objective of, okay, I'm super busy. I'd read your book if I had more time, but I don't have that much time right now. Is there a Reader's Digest version you can give me to kind of quickly get started? And so that's what we made at that URL.
That's awesome. I will add that to the status here so that you guys can just click that link. Okay, last question. This is from Diana. Can your stools fluctuate when your hormones are out of balance? I experience rectal bleeding, sometimes loose stools, sometimes not, typically never constipated, which causes hemorrhoids. No rhyme or reason, totally out of the blue. Sometimes my bleeding is spontaneous with the absence of visual hemorrhoids. I cannot tie this to what I eat. This completely resolved when I received bioidentical pellets, but now it's back since the pellets are gone. Is this related to the gut or to hormones? Possibly iron and ferritin. I lose a lot of blood and I don't experience bloating or gas.
Well, it's a very serendipitous question with what we just covered.
Yeah, right.
Yes, the impact of female hormones on the stools is understood, and this is something that I discussed with Dr. Satish Rao on the podcast a while back. That the colon does have a fair amount of progesterone receptors. I believe it's progesterone specifically, more so than estrogen. But we do know that female hormone receptors are fairly well dispersed throughout the colon and do impact motility. And one of the reasons why that's one of the three variants, the gut female hormone connection, is because I see that so commonly. And I even have a small section in the book about female hormones, because it is fairly common enough to include that in a book that's focused on gut health. There was this one tangent into female hormones because of that common connection. So yes, female hormones do affect your gut. Your gut does also conversely affect your female hormones. And fortunately, these systems tend to track together. Now, it's unfortunate if things are going south, because then both things are going south. Yeah. But if we start supporting your gut and also use some of these herbal medicines that are very safe and help to coax the female hormones back into balance, now things will start tracking in a improvement direction together. And so, yes, I would take the quiz, either buy the book or take the quiz, and you'll see that there's two compounds I use in addition to the kind of core gut healing program, which are Estro Harmony and Progest Harmony. And these are both herbal medicines that help to coax the female hormones back into balance. They don't contain any hormones themselves. And there's a fair probability that you'll be more regular. And if you're experiencing anything like irregular cycle length or PMS or what have you, then you may see those improve also. And the fact that you responded previously to pellet therapy is a huge flag that this is a system that needs support. There's different ways you can do that. I have no problem with pellets or bioidentical creams. My preference, start people with herbs rather than going right to some kind of prescription hormone.
Okay, awesome. Why don't you tell us, Dr. Ruscio, where we can find supplements and other support that you've actually aggregated together to make gut healing a lot easier, so we're not marching all over the place trying to find things, and where can people learn more?
Right. Well, thank you. And that's one of the reasons why we launched the store was just to give people everything that they need in one spot. And I'm happy to say that we've done a good enough job with the back end infrastructure where we now offer free shipping on everything to make this really just as easy as we can for people. Because what I don't want people to do is be challenged by reading and understanding the concepts, and then they're going to Amazon and all these other stores and trying to price compare and save money on shipping. So we try to make it as easy as we can. You can get everything at our store, which is accessible through our website, which is drruscio.com. And you'll see we've broken the supports down into different categories. And if you read the book, you'll see that the steps have a step 1 book protocol, step 2, step 3, to make it easy to navigate. And we have a number of things there, like the probiotic protocol, like the female hormone support herbs. Some things are unique formulations that I've created. Some things are formulas by other companies that I like. But pretty much everything that I use and recommend is there all in one place. And it's not the only place I'd recommend going, but it's meant to help give you everything that you would need on your journey in one simple stop to shop.
Awesome. Well, I'm super excited to send out this interview to everyone in our community. We've been waiting on pins and needles, knowing this was coming. So thank you so much, Dr. Ruscio, for continuing to support us on this journey. I really appreciate you taking the time today.
Yeah, thank you for having me. It was a lot of fun.
All right, we'll see you guys.